Your body started warning you about high blood sugar long before any lab result ever would. The question is whether you know the language it is speaking. Because the very first place your body delivers that warning is not your blood, not your vision, not your energy levels. It is your feet. And the signs it leaves there are specific, readable, and almost universally misread as something else entirely. My name is Dr. Victoria Chung. And what I want to tell you today is something I have confirmed in my office every single week of my career. Diabetes does not arrive without warning. It announces itself repeatedly, in the same 9 places on your feet, in the same sequence, months and often years before a blood test would ever catch it. The problem is not that the warnings are subtle. The problem is that nobody has told you what you are looking at. Before we go through each sign, 60 seconds of physiology, so everything that follows makes complete sense. Your feet are the furthest point in your body from your heart. They sit at the end of the longest circulatory and neurological routes in your entire system. This is precisely why they are the first place elevated blood sugar announces itself. Think of it this way. If something goes wrong in a city's water supply, the neighborhoods at the far end of the pipeline lose pressure first. Your feet are that neighborhood. When blood sugar begins damaging blood vessels and nerves, the damage appears at the extremities long before it registers in the organs closer to the center of the body. By the time standard lab values become abnormal, the feet have typically been signaling the problem for 1 to 3 years. The American Diabetes Association estimates that 1 in 5 Americans with diabetes currently does not know they have it. That is over 8 million people living with a condition that is actively damaging their nerves, their kidneys, their retinas, and their cardiovascular system right now, today, while they assume they are fine because nobody told them where to look. I want to change that today. 9 signs, what most people assume each one is, what is actually happening inside the body, and one specific daily habit that addresses each one directly. Sign number 1 is tingling, numbness, or the pins and needles sensation in the feet. Almost every patient I have ever discussed this with has already explained it away before they came to see me. My foot just falls asleep sometimes. I was sitting with my legs crossed. And yes, that happens to everyone occasionally. But I always ask them the same follow-up question. Is this happening regularly, without a clear positional reason, and in both feet? Because when the answer is yes, what we are likely looking at is peripheral neuropathy, the earliest neurological consequence of sustained elevated blood sugar. Here is what is happening inside the body. Every nerve in your body is wrapped in a protective coating called the myelin sheath. Think of it the way you would think of the plastic insulation around an electrical wire. That coating is what allows nerve signals to travel cleanly and accurately from your brain to your foot and back. When blood sugar remains elevated over time, excess glucose binds to proteins in that coating through a process called glycation, progressively degrading its integrity. The wire still functions for a while, but the signal becomes intermittent. That intermittence is the tingling you feel. It is not your foot falling asleep. It is your nerve sheath being chemically eroded. The American Diabetes Association reports that peripheral neuropathy affects nearly 50% of people with diabetes and almost always begins in the feet before progressing upward, which means tens of millions of Americans are experiencing this sensation right now and attributing it to something it is not. My daily recommendation is a 20 to 30-minute walk every single day, not a jog, a consistent, purposeful walk. Movement increases blood flow to peripheral nerve tissue and has been shown in multiple controlled trials to slow neuropathic progression in pre-diabetic and early diabetic patients. Simultaneously, begin reducing added sugar today, not next month. The nerve damage is happening now, and the intervention needs to begin now. Sign number 2 is burning pain in the soles of the feet, particularly at night. My patients describe this one more vividly than almost any other symptom. They tell me it feels like their feet are on fire. And it is almost always worst at night, when they are lying still in the dark with nothing to distract from it. Many of them have been blaming their shoes, their job, the summer heat, for months before it occurs to them to mention it in a medical context. Here is what is happening. The same nerves that were producing tingling in sign 1 have now progressed to a different stage of dysfunction. Rather than simply transmitting garbled signals, they have become hyperactive, firing spontaneously and sending heat signals to the brain even in the complete absence of any external heat source. The brain receives the message and interprets it as burning because that is the closest category it has for what it is receiving. Think of it like a fire alarm with a faulty sensor. The building is not on fire, but the sensor is damaged and the alarm is screaming anyway. Research published in the journal Diabetes Care found that burning foot pain is among the first reported symptoms in patients later diagnosed with type 2 diabetes, typically presenting 1 to 3 years before formal diagnosis. It is not a late sign. It is an early one that most people endure in silence because they do not recognize it as a signal worth reporting. 2 habits I recommend for this sign. First, drink at minimum 8 glasses of water daily. Proper hydration supports kidney function, which is responsible for filtering excess glucose from the bloodstream, reducing the glycation load on peripheral nerve tissue. Second, add soluble fiber to every meal. Oats, legumes, non-starchy vegetables. Soluble fiber slows the absorption of glucose into the bloodstream, reducing post-meal sugar spikes that are among the most damaging events for nerve tissue over time. Sign number 3 is a wound, blister, or cut on the foot that is not healing normally. This is the sign that sends more patients to the emergency room than any other on this list. And the story is almost always the same. I had a small blister for my shoe about 3 weeks ago. I figured it would close on its own. I have heard this dozens of times. And in most healthy adults, they would be right. But in someone with sustained elevated blood sugar, the biology of wound healing has been fundamentally compromised in ways that are not visible from the outside. When blood glucose remains chronically elevated, the small blood vessels throughout the body, and particularly in the feet, undergo structural changes. The vessel walls thicken and stiffen. The interior diameter narrows. This means that oxygen, white blood cells, growth factors, and the full array of biological resources that repair tissue cannot reach the wound site in adequate volume or on adequate schedule. Imagine trying to water a garden through a hose with a severe kink in it. The water exists. The pressure exists. But the delivery is compromised. That wound sits open, exposed to the environment, unable to close, and in an anatomical location that makes it impossible to avoid contamination. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, accounting for over 100,000 procedures annually. Nearly all of them began as a small wound that was not recognized for what it represented. My recommendation tonight, after your bath or shower, sit down with good lighting and examine both feet completely. Look at the heel. Look between every toe. Look at the ball of the foot. Any break in the skin should be cleaned with mild soap and water, treated with an antiseptic, and covered. If it has not improved meaningfully within 48 hours, contact your doctor. Not next week. 48 hours. Sign number 4 is discoloration of the skin around the ankles, particularly darkening or a deep reddish tint. Patients see this and tell me it is sun damage, or that they have always had darker skin in that area, or that it has just always been that way. And sometimes that is true. But there is a specific pattern of discoloration I look for when assessing vascular compromise from elevated blood sugar, and it follows a predictable anatomical logic. When circulation is impaired by blood vessel damage, the tissues furthest from the heart receive inadequate supplies of oxygenated blood. The skin of the lower legs and ankles, already at the end of the longest circulatory route in the body, responds to that inadequacy by changing color. Darkening, deep reddening, or in more advanced cases a dusky bluish tint around the ankles are all visual signals that the tissue in that region is not receiving what it needs. In some patients, the skin in these areas also becomes thinner, more fragile, and slower to respond to touch. These are not cosmetic changes. They're the skin communicating vascular distress in the only language available to it. A study published in the Journal of the American Academy of Dermatology found that these skin changes are detectable on average 18 months before a formal diabetes diagnosis in affected patients. They are not a late-stage finding. They're a mid-course warning that most people look at and do not recognize. The daily habit here is 5 minutes of ankle circles, toe raises, and calf stretches every morning before you stand up. Even this minimal movement creates meaningful increases in peripheral blood flow. If mobility is limited, elevating your feet several inches above heart level while seated accomplishes a similar effect by assisting venous return from the lower extremities. Sign number 5 is severe or persistent cracking of the heels that does not respond to moisturizer. I hear this one constantly. My heels crack every winter. It is just dry skin. And seasonal heel cracking is genuinely common and usually benign. But when heels are cracking severely in the middle of summer, or when no amount of moisturizer produces any lasting improvement, that is a different clinical picture entirely. Diabetes damages not only the sensory and motor nerves, but the autonomic nerves, the ones that regulate functions the body performs without conscious direction. One of those automatic functions is the regulation of sweat and sebaceous secretion in the skin of the feet. When the autonomic nerves supplying the sweat glands of the foot are damaged, those glands progressively reduce or cease their output. The skin loses its moisture from the inside out through a mechanism that no external lotion can address, because the problem is not at the surface. It is in the nerve supply beneath it. Think of your skin like a wall constructed with mortar between the bricks. When the autonomic nerve damage disrupts the skin's internal moisture regulation, the mortar begins to fail. Cracks appear. And in a foot with compromised circulation, those cracks are not a cosmetic inconvenience. They are open entry points for bacterial infection in tissue that cannot mount an adequate healing response. The American Podiatric Medical Association identifies chronic treatment-resistant heel cracking as a significant indicator of autonomic neuropathy in older adults, a condition directly linked to sustained elevated blood sugar. Autonomic neuropathy is not a minor finding. It indicates that the nervous system's non-voluntary functions are under serious metabolic stress. Moisturize every night before bed, applying thoroughly to the sole and heel but never between the toes, where trapped moisture creates conditions for fungal infection. And prioritize hydration from the inside. 8 glasses of water daily supports skin integrity through the same mechanism that it supports nerve tissue and vascular function. Sign number 6 is persistent swelling in the feet and ankles with deep sock marks by evening. Almost every patient I have seen with this tells me the same thing first. I stand on my feet all day, or I sit at a desk all day. Occasional swelling from either of those things is physiologically normal and resolves overnight. But if your feet and ankles are consistently swollen by evening, if pressing your finger into the swollen area leaves an indentation that takes seconds to fill back in, that is called pitting edema, and it is a different situation entirely. High blood sugar damages the kidneys through a progressive process called diabetic nephropathy. The kidneys are responsible for regulating fluid balance throughout the entire body, filtering excess fluid and waste from the blood and excreting it. When kidney function is compromised by chronic elevated glucose, fluid regulation becomes impaired. The body retains more fluid than it should, and that fluid, pulled downward by gravity, accumulates in the lowest point of the body, your feet and ankles. Think of your kidneys as the filtration infrastructure for a city's water system. Every drop of water in the system passes through them to be cleaned and balanced. When that infrastructure is progressively damaged, the system backs up. Fluid accumulates where it should not. The visible result in your body is persistent ankle swelling that your shoes feel tighter in the evening than the morning, and that sock elastic leaves deep indentations in your skin. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity edema is frequently the first visible indicator that filtration function is being compromised. Catching this sign early means catching kidney involvement early, when intervention is most effective. When resting, elevate your feet above the level of your heart, even a few inches on a firm pillow. This assists the venous return of accumulated fluid back toward the body center. Simultaneously reduce sodium intake. Salt causes the body to retain water, significantly worsening fluid accumulation in already compromised tissue. Read labels carefully. Canned soups, processed meats, and packaged foods carry sodium loads that most people do not anticipate. Sign number 7 is intense stabbing or electric pain in the feet, particularly at night, that has been attributed to arthritis or an old injury. This is the sign I see most frequently misdiagnosed, particularly in men, who are more likely to manage pain independently for extended periods before seeking evaluation. I have had patients tell me they had been taking ibuprofen for foot pain for 8 months before they came to see me. They assumed it was an old sports injury or the beginning of arthritis. And sometimes it is. But sometimes the pain has a completely different origin, one that ibuprofen will never resolve. When sensory nerves are damaged by chronic hyperglycemia, they do not always become quiet. In many patients, they become paradoxically hyperactive. Instead of losing the ability to transmit sensation, they begin generating signals spontaneously, without any external stimulus, and those signals arrive at the brain as severe pain. Patients describe it as stabbing, electric shock, or the sensation of a hot needle being driven through the foot. It is typically worst at night when there are no competing sensory inputs to override it. Think of a damaged car alarm after a minor collision. Every few minutes it triggers unprovoked, screaming at full volume with no intruder anywhere in sight. The alarm mechanism itself is broken and generating false signals. A nerve damaged by sustained elevated blood sugar does the same thing. The pain is completely real. Its source is the malfunctioning nerve, not any structural injury that ibuprofen can address. A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with diabetes and is most frequently misattributed to arthritis, tendinitis, or age-related joint degeneration. The average delay between symptom onset and correct diagnosis in that cohort was over 2 years. Every morning before getting out of bed, spend 5 minutes gently flexing your feet, circling your ankles, and pulling your toes slowly back toward your shin. This activates circulation in the peripheral nerve tissue before mechanical load is applied. Every night before sleep, give your feet a gentle 3-minute massage using slow circular strokes along the sole and up toward the ankle. This directly stimulates blood flow to the nerve beds that are generating the pain signal. Sign number 8 is feet that remain cold regardless of the ambient temperature, cold in summer, cold under multiple blankets, cold when the rest of the body feels warm. Almost every patient I have had this conversation with says the same thing first. I have always had cold feet. My wife has stolen the blankets for 30 years, and I acknowledge that. Cold feet are common and usually benign. But then I ask the follow-up question that changes the conversation. Are your feet cold in July? Are they cold under 3 blankets while the rest of your body feels warm? Because that is when the picture shifts entirely. Feet that remain persistently cold independent of environmental temperature are a strong indicator of significantly compromised peripheral circulation. Your blood vessels have narrowed or stiffened to the degree that warm, oxygenated blood is not arriving at the feet in sufficient volume to maintain normal tissue temperature. Think of your circulatory system as a heating system running pipes to every room in a large building. When those pipes narrow from sustained damage, the heat does not reach the rooms at the far end. The room stays cold no matter how hard the furnace works. The problem is not the furnace. It is the pipes. The American Heart Association identifies peripheral artery disease, caused by narrowed blood vessels, as affecting over 8 million Americans, with diabetes representing the single largest independent risk factor. Persistent cold feet are one of its earliest and most consistent symptoms, and they appear well before the condition reaches a stage where intervention becomes complicated. The most effective response is a 30-minute brisk walk daily, not a leisurely stroll, but a purposeful walk with arm movement and maintained pace. This forces blood flow into the feet and lower legs, creates mechanical stress on vessel walls that stimulates their maintenance and repair, and over time has been shown to partially reverse early-stage peripheral arterial narrowing. Begin with 10 minutes if 30 feels excessive. The critical factor is beginning today. Sign number 9 is the one I have almost never seen covered in a patient education brochure, and I want to give it particular attention because of how consistently it is overlooked, including by physicians. During a foot examination, I look at the lower legs and the tops of the feet for something most patients have never been asked to notice. the gradual disappearance of hair from the lower legs and the dorsal surface of the foot. When I point it out, the patient looks down and says, "I never noticed that." And that is exactly the problem. It is a quiet, gradual change that leaves no pain, no discoloration, and no obvious sign of anything being wrong. Hair follicles require a continuous, reliable supply of blood and oxygen to function. When peripheral circulation is significantly impaired by long-standing elevated blood sugar, the follicles at the furthest reaches of the body, the lower legs and feet, gradually stop receiving what they need to sustain hair production. They do not die immediately. They simply stop growing. Think of them as small plants at the end of a garden irrigation line. When the water pressure in that line drops, the plants at the far end do not wilt overnight. They simply stop producing new growth. Gradually, quietly, in a way that takes months to notice if you are not specifically looking. Research published in Diabetes, Obesity and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients and represents a reliable clinical indicator that physicians are specifically trained to assess. The challenge is that most patients never examine this area with any attention and never mention it because it does not hurt. Immediately after this video, look at your lower legs and the tops of your feet. Compare the hair density there to your upper leg or forearm. If the hair is significantly thinner, sparse, or absent entirely in those areas, schedule a fasting blood glucose test this week. Not this month, this week. It costs approximately $12 at any certified laboratory and is covered by Medicare. For most of you, $12 is the most important health expenditure you can make right now. Now I want to add 4 clinical insights that go beyond the 9 signs. Things I tell my patients in the office that most people never hear outside of a medical setting. The first insight is the morning foot temperature test. Before you get out of bed each morning, place the back of your hand against the top of each foot and compare the temperature between them. A consistent temperature difference of more than a few degrees between the left and right foot, or between the foot and the lower calf on the same leg, is a clinically recognized early indicator of asymmetric vascular compromise. Vascular damage from elevated blood sugar rarely progresses at identical rates on both sides. This simple daily comparison costs nothing and takes 10 seconds. If you notice a persistent temperature asymmetry, report it to your physician. The second insight involves the connection between sleep disruption and blood sugar. Many of my patients with undiagnosed prediabetes report significant worsening of their foot symptoms after poor nights of sleep, and they assume the correlation is incidental. It is not. Sleep deprivation of even one night has been shown in controlled studies to raise fasting blood glucose by up to 20% in prediabetic individuals through cortisol-mediated insulin resistance. Poor sleep worsens blood sugar. Worsened blood sugar accelerates nerve and vessel damage. Accelerated nerve and vessel damage intensifies every sign on this list. Prioritizing consistent sleep of 7 to 8 hours is not a comfort measure. It is a direct intervention in your glucose metabolism. The third insight is the relationship between footwear and wound risk. Most diabetic foot ulcers, the ones that lead to the amputations I mentioned, do not begin with obvious trauma. They begin with friction, seams inside shoes, slightly tight toe boxes, the edge of an insole. In a foot with intact sensation, friction becomes uncomfortable quickly and you adjust. In a foot where sensation has been reduced by neuropathy, that friction produces injury without any pain signal. You walk on a developing wound for days without knowing it is there. Check the interior of every pair of shoes you wear regularly. Run your hand along every seam and surface. If you cannot feel pain reliably in your feet, your shoes need to protect you from friction in ways your nervous system no longer can. The fourth insight is the most commonly overlooked dietary factor in blood sugar management after age 60. Most of my patients focus on reducing carbohydrates when they think about blood sugar control, and that focus is partially correct. But the factor that has the largest single impact on post-meal glucose spikes, the spikes that do the most acute damage to nerve and vessel tissue, is meal sequencing. Eating vegetables and protein before carbohydrates at any given meal has been shown in clinical trials to reduce post-meal glucose peaks by up to 37% compared to eating those same foods in conventional order. No change in what you eat. A change only in the order you eat it. Vegetables and protein first. Carbohydrates last. Every meal. Let me come back to where we began. Your body started warning you long before any lab result would. The warnings are specific, readable, and almost universally misattributed. You now know what 9 of the most consistent ones look like, what is happening inside the body to produce each one, and what you can do starting today to address each mechanism directly. Here is what I am asking you to do tonight. Before you go to bed, sit down in good light and examine both feet completely. The skin, between the toes, the heel, the lower leg, 30 seconds. If you notice any sign from this list, even one, write it in the comments below. Write the number and one sentence about what you noticed. I read every comment on this channel, and if what you write prompts me to respond with a concern, that response might be the thing that gets you to make an appointment that changes everything. Share this video with one specific person today. Not everyone you know. One person. The one whose feet are always cold. The one who mentioned a wound that would not heal. The one who has been taking ibuprofen for foot pain for months and attributing it to old age. What they do not yet know is that their body has already been telling them something. They simply have not had anyone explain what it was saying. I am Dr. Victoria Chung. Take care of your feet. They have carried you through every day of your life. Now it is your turn to pay attention to what they are telling you. I will see you in the next one.